Hi, this is Dr. Paresi at Contour Plastic Surgery and Med Spa, and today we're going to talk about the top 5 reasons why we think we offer the best experience for tummy tuck patients here at Contour Plastic Surgery. So the first reason why we think we offer the best experience for patients having tummy tuck is that we use a drainless technique. So what is a drainless technique for a tummy tuck? So this is a surgical drain. And this is used for when physicians or plastic surgeons use a drain during a tummy tuck. This is what they're using. You can see it's a really long plastic device. It comes out of your incision, and it will actually hang out of your incision until it's removed by the surgeon. That is the #1 cause for postoperative complaints for patients, is related to drains. If you go on any social media sites and look at patients and that talk about their experience after tummy tucks, a lot of times they're related to drains and then pulling or uncomfortableness or just overall bad experience related to the drains. At Contour Plastic Surgery, we don't use drains at all. So we use a drainless technique. A lot of patients ask, well, how do you do a drainless technique? What happens to the fluid? Where does the fluid go? So there's 2 differences about a drainless technique for tummy tucks. #1 is the way that we do the dissection. So the way that we actually separate the tissue and remove the excess skin is different. And then the way that we close up the incisions and close up the dead space is also different. Because of those 2 differences, we don't need the drains. So that really results in a much better experience for patients. #2 reason why we believe we give the best experience for patients getting a tummy tuck here at Contour Plastic Surgery is that we have a proprietary technique for recreating the belly button. So if you think about it, the belly button is the #1 most exposed part of a tummy tuck after a tummy tuck. We're talking about after you're already healed. So even if you're able to cover up your lower abdominal scar, you cannot cover up the belly button. And so that is usually the #1 cause for patients of they're unhappy with their aesthetic result is related to the belly button. So here at Contour Plastic Surgery, we have a proprietary technique that allows for a very thin, narrow belly button with a really nice shape that has what's called upper hooding that gives a more natural appearance. And you can look at our post-operative results, and the patients look like they have a normal belly button. If you look at some other sites, sometimes the belly buttons don't look great, and also the scar around the belly button is more apparent. The way that we do it actually results in a much more aesthetically pleasing belly button. The third reason why we believe that we offer the best experience for patients with tummy tucks, having tummy tucks, is the use of Exparel and another newer medication called Jornavix. So both of those medications are involved in better postoperative pain control. And so the Exparel is actually an injection that's done at the time of surgery into the abdominal wall in the area where we do the muscle tightening. So the majority of patients that are getting a tummy tuck have some element of muscle tightening, and that can be a real source of pain afterwards. So this injection is injected at the time of surgery around the area where the muscle is tightened, and it usually lasts for up to 5 days after surgery, decreasing the need for narcotics and just resulting in an overall better experience. And then secondarily, we're also using a newer medication called Jornavix, which is a new type of pain medication. It is not a narcotic, so it doesn't have a lot of the side effects of narcotics, and it can be started right after surgery and really decrease the need for postoperative narcotics. So that's also a new adjunct, a new medication that we're using for patients after a tummy tuck that's really resulted in better experience overall. The 4th reason why we believe we offer the best experience for tummy tuck patients here at Contour Plastic Surgery is that we use a really low placement of our lower abdominal scar. So what this allows patients to do is cover up the scar. Obviously with the tummy tuck, the trade-off is the scar, so you can't do it without making an incision, and the incision usually is from hip to hip, so it's a fairly long incision. But if you place the incision low enough, patients can put clothes over it, they can wear a 2-piece bathing suit, things like that that really result in a better experience, and patients are much happier. If the scar is too high, then they can't avoid and can't cover up the scar, and sometimes that is a source of dissatisfaction for patients after a tummy tuck. So the last reason why we believe we offer the best experience for tummy tuck patients here at Contour Plastic Surgery is that we do liposuction of the waist and back bar rolls in the majority of patients that are getting a tummy tuck. What that allows us to do is really narrow the waist and give the patient a much better trunk shape. Most patients, when they're seeking a tummy tuck, really want to narrow their waist and give them more of a feminine shape. And so by doing the liposuction, we're able to remove that extra fat and really shape the waist area. The waist is defined as the space between the hips and the ribs. And when that's filled in with fat, and sometimes if there's a muscle separation, that is not as well defined. By doing liposuction of the back bar rolls and waist in combination with a tummy tuck, that really allows us to really define the waist area and give a much better shape.